For the MyMCM Honors Annual Award, this year we selected the county's first responders due to their extraordinary work on the front lines throughout the COVID-19 pandemic. Dr. Travis Gales, we're interviewing you on behalf of the county's first responders. As Montgomery County's health officer, how has the joint response between you and healthcare workers been throughout this health crisis?
Well, none of the efforts that we put into place as a county would be successful without the tireless efforts across the board from our staff who many had other assignments before COVID, but they've repurposed and picked up quickly to manage different levels of the response, including our public health team across the board, from all of our administrative staff to our emergency preparedness teams to the folks in fire and rescue, our police, our corrections team. And also our other staff across the board. We could not have done this and be where we are today without the tremendous work and efforts of all of those people.
Now, COVID-19 caught the world by surprise. How has Montgomery County prepared since the spring when the virus first hit this area? I know that you said there's been increased PPE, the testing efforts have been ramped up, and hospitals are better prepared for a possible surge.
Well, the biggest thing is we learned as COVID hit all of us. And even though we had practices through different exercises, this is the event of a career for pretty much everybody because no one has lived through this type of experience before. So even in our best intentions and pulling on all of the expertise we had, we were learning new things every day. So for example, the beginning part of the pandemic, no one had on a face covering because we didn't think you could transmit it unless you were noticeably ill. And when that was announced, we pivoted along with everyone else to include that type of guidance in terms of how we move forward. And one of the great things about the county apparatus is after that first significant surge of cases, we didn't just rest and say, we're done and the numbers are better. We'll just wait until it happens again. The county aggressively pursued and purchased PPE, recognizing this could happen again. The hospitals kept their playbook in place. We increased our opportunities for testing across the board in the community. And we continue to look for new strategies to educate the public about the risk of different activities, again, anticipating that we would see a second wave of cases happen and making sure that we were prepared when it did so.
And that leads me to my next question. What has been some of the challenges for you and frontline healthcare workers throughout all of this?
There's a number of them. I think the first one is that everyone who is in this type of work goes into it because they have a genuine desire to help people. And when you have that genuine desire to help people, it can also be a little bit exhausting because you're putting 110% every hour you're on the job. And you're constantly thinking about, how you can improve and how you can do things better and how you can help people more. So it has been physically and mentally exhausting, honestly. I think the second component of which makes it a little bit trickier in the second wave of the response is, it's a delicate balance when you're seeing you're having to respond and provide health guidance, and you're having to provide healthcare service delivery. And you're seeing the firsthand effects of what this virus has done on the community and how it wreaks havoc in individuals and wreaks havoc in, families, et cetera. And on the flip side, there are harsh economic realities that we have to face as a community. And, we know that, for example, putting in restrictions while it's keeping people safe, and we need to do that, does have some unintended consequences, whether it's economics or, mental health and all of those kinds of things. So it's tough to sit and balance, and it's also tough when you do have those in the community who don't quite understand that you're motivated by those factors and you're motivated to keep them safe and don't quite get the sincerity within which all of us in the healthcare field are operating from.
What are some of the things that the community can do to do their part to help stop the spread of this virus and to help keep the community safe?
Well, the big things are continuing to adhere to the guidance that we're putting forward, trusting as best as they can the information that we're putting out, and understanding that when we do put forward guidance, this is something that has been vetted, it's thought through very carefully, it's pressure tested beside the most recent up-to-date guidelines and evidence-based practices. And when we're asking you to do things, we're not creating arbitrary standards. We are really asking you to do things that have been proven or highly suggestive of having an improvement on mitigating the spread of the virus.
Is there anything you'd like to add in regards to how you've worked with these healthcare workers and frontline responders or first responders?
It's a tremendous thank you. This is really a group effort and a team effort. And I cannot underscore just how much we are fortunate to have the level of healthcare expertise, whether we're talking about our clinicians and our hospitals and health systems, again, our emergency responders, the folks who are staffing our testing apparatus, our soon-to-be vaccine apparatus in terms of disseminating that out to the public, as well as the administrative staff who is often behind the scenes, but they are working nimbly to get meetings scheduled, to get contracts moved forward, in processes that are new, because we've had to reassess and reevaluate the way we do business in terms of being a leaner, more efficient system that has to act very quickly in an emergency situation. So I would just say a huge thank you across the board. And if I happen to miss anyone who's included in that, know that there's a sincerest thank you for creating the space for us to be able to move forward and keep our residents safe and do our jobs.